For those of you who are joining us through the YouTube, our YouTube channel, we're waiting until 1:34 to start the meeting. Just waiting for a few people to join us.
Okay, well, I'm going to get us started. Welcome, everybody. Good afternoon. This is the Mendocino County Homeless Services Continuum of Care Board meeting for Monday, May 16th. Both of our co-chairs are not able to make it today. Jackie Williams has jury duty and Dan McIntyre had something else that was critical that he could not escape from. So I will be chairing the meeting today just in the interest of efficiency, because we realized I'm not sure who's supposed to chair the meeting when both the co-chairs are gone. So just going to pick up and go with it for now. So I'm going to call us to order right now. And Carly, can you do a roll call for attendance?
Yeah. Luz Martinez, Roseanne Ibarra or Faith Dayton, Lisa Judd,
Present.
Jacqueline Williams or Drew Yakamini Hare, Natalie Shepard,
Present.
Libby Guthrie, Paul Davis, Xenia Levicho, Karen Lovato,
Here.
Blythe Post or Brady Nord, Amanda Archer, Judy Albert,
Here.
Camille Schrader or Sage Wolf, Dan McIntyre or Ryan LaRue, Noble Wadelick,
Here.
Rachel McDavid, Will Van Sant,
Here.
and that's it, correct?
Yes, I believe it is. So we have 6 members present, which is not a quorum. Luckily, we don't have any action items today, so we will move through our agenda efficiently. But I'm going to note for the record that we have 6 members present. I'll have more to say on this when we get to the membership committee. Let's see, we have 2 sets of minutes. Oh, let's see, public comment. Is there any member of the public that would like to speak on a non-agendized item? I'm happy to welcome Margaret Kisliak from Partnership Health Plan and Denise Gorney and Tony Fort from Mendocino College, who look like our members of the public today. So if any of you have anything to comment on, now would be the time.
Hi, this is Margaret Kisliak from Partnership Health Plan. I just want to let everybody know that we're ready to move. We have the guidance that we needed from the state in terms of moving forward on the incentive money that we're going to be providing in conjunction with the county. So a lot more to come on that, but the money is going to be fairly flexible. So that's that, and it can be used on capital spending. So we're really looking forward to working with the county and the COC on how we can supplement your HAP work and help people in Mendocino County.
Great, thank you, Margaret. Okay, we have 2 sets of minutes here. We have the, oh wait, no, we don't have any minutes. So
No
the
minutes.
April minutes will be available at the July meeting. So there are no minutes to approve. We're going to move to item D1, updates from local jurisdictions. Karen, would you like to give an update from the county if you have anything to share?
I don't have a tremendous amount to share. May is Mental Health Month, so we've been doing some outreach events, and we've been present at health fairs throughout the county, as well as some of the mental health providers have been also raising awareness through various different activities and events. So just if you see a lime green ribbon or a health fair event, stop by and say hi to the mental health teams working at those.
Great, thanks, Karen. I will add just from the county update, the selection, well, I don't know if I want to call it the selection process, it is the selection process. The selection process for Ore Creek Phase 2, this is 19 units that that are going to be, in theory, opening in June or July. June is like next month. I think the end of June. Doesn't look like it, but anyway, the schedule is the end of June for, I think there's an additional 40 units, 19 of which have been set aside for homeless individuals through No Place Like Home funding and HEAP funding. And the selection process for this project is complicated because it is initiated through coordinated entry system, but the individuals also have to have other layers of qualification through the behavioral health system. So it's a little bit complicated, and we're just beginning to work through that process. I don't know if there's any other updates from the county, so I'll move on to the city of Ukiah. Noble, do you have anything to share with us from the city?
Well, from the police department, we just rolled out our special considerations form last week, so it's available online. And if somebody has a person they're concerned about, they can complete the form, either mail it in, fax it in, email it in, and we'll potentially have some needed information.
Great, thank you.
That's about it for us.
Okay.
Could
City
you-
of Fort Bragg, I don't think, Judy, did you have something to say?
Yeah, I just want to know, well, I'm not registering what the special considerations form is.
We put together a form. It could be for either medical reasons, mental health reasons, behavioral reasons. If, like, Judy, if you had a client that you were like concerned, about their behavior or what they might do, like say in the event that they went missing, like, some people are like, drawn to water or whatever, you could complete this form and then we would have it on file in dispatch, tagged to their known address. Unfortunately, we can't tag people yet with our old CAD system, but hopefully in the future we'll be able to do that. And then the dispatcher would be alerted to, tell the officers, hey, there's special considerations form completed on this individual, call into dispatch for additional details or et cetera. It might be like the person's hostile to law enforcement too. That could be.
Okay. Okay. Got you. All right. Thank you. And I need to talk to you after this meeting.
Okay.
Okay, City of Fort Bragg, it doesn't look like we have any representatives from the City of Fort Bragg present or the City of Point Arena. So I don't think there's any other jurisdictional updates. Standing committee reports, strategic planning committee. This is item D2A. Veronica, do you want to update on the strategic planning committee, or it'll be brief because we haven't met, but.
We are scheduled to meet on Friday, May 27th. It is the Friday before Memorial Day. So there's been at least one or two people who've said that they're not going to be able to come because of that conflict. But I think enough folks have responded that they're available that we'll have a quorum. So that meeting has been added to the public webpage. I just haven't created an agenda yet. So an agenda is forthcoming. We're going to be looking at the strategic plan revisions that Mari and Megan have been working on. We're going to look at the HAP round 3 application performance goals, to set some performance goals for the whole COC. And I think we're going to not talk about the content of the membership committee's work on the governing board revisions, the potential possible redoing of that. And so I don't think we're going to talk about the content of it, but rather how to move forward with planning for it. And those are the main items on that meeting.
Okay, thank you for that. or Shelter and Solutions Committee. Angelica, do you have anything to share?
Sure. Well, we did meet. It had been a while since we met. So it was more of a brainstorming session about things that we might want to address or look at in the future. And again, it was more of a discussion. We didn't nail anything down, but issues we talked about were current policies on discharge planning from the jails, what folks are seeing on the ground in terms of citations under the community's various anti-camping ordinances. And also we discussed the what's going on in terms of like coming up with a centralized housing sort of navigation center because of concerns around one of the concerns being in terms of selection processes. I think you mentioned like Gore Creek. So as an example, in terms of, how can those processes be more transparent and equitable so that the community knows what exactly is going on. Oh, I just got a notification that recording in progress. So sorry about that. I don't know if you all heard that. I think that's it for our discussion. And then our next meeting is going to be June 14th at 11 by Zoom.
Great, thank you, Angelica. Any questions for Angelica? Okay, so coordinated entry discharge planning. I know this committee's been pretty active. I do not see Sage here or either of the co-chairs. Veronica, do you want to give an update on that, or is there somebody else?
Yeah.
Okay.
No, I can do that. They've moved the meeting to the third Thursday of each month, from the first Thursday to the third Thursday at 9 a.m. So same time, same place, just third week of the month. They've been working on cleaning up the COVID-19 risk factor scoring, exactly how the policy was written. It was missing some points and some other things. So they worked on improving that. There's been some discussion on supporting clients with who are rapid rehousing recipients who actually need more long-term assistance or would be better served or their needs met better with PSH. And so we've been working with our coordinated entry TA through HCD. They have a proposed transfer plan that includes a lot of the mechanisms that would be needed to be put in place for something like this to happen. So they're looking at how to better shore up coordinated entry and to make it more working better. Aya or Brian, I might have you speak a little bit more on this if necessary, but the coordinated entry committee is also looking at, well, the HMIS lead has offered to do some better reporting and generation of the by name lists instead of relying on specific, and I'm letting Sage in right now, so that's good. So they're working on the, instead of relying on case manager saying yes or no, this person is chronically homeless, rather it would be dynamic reporting where it would pull those items and be smart and determine from what the case manager reported and other questions, is the person chronically homeless? Welcome, Sage. Really glad to see you. I am working on doing the coordinated entry discharge planning committee update. I've shared that there's been some COVID-19 factor updates. I was talking about the HMIS being able to provide better reporting, anticipated. And do you have anything to add to that?
Sage, can you hear us, Sage? We're putting you a little bit on the spot here.
I just admitted a phone, so maybe that's Sage. I'm going to say that's all that I know about. But Sage, if you can hear me, you're welcome to provide input on the committee. For coordinated entry, you can't hear me. So,
Veronica, why don't we,
that's all I have.
let's move on to membership, and we can give Sage the opportunity to connect and come back in at
Okay.
a little bit of a later date. So our membership committee still has not met. Do you want to chime in a little bit here, Veronica, or there's not a whole lot to say yet?
Well, I'm the chair, and there's the next meeting is still to be determined. Dan is still working on reviewing the attendance information to so that we can do some work on potentially identifying alternative agencies for any like COC board seats that haven't been represented in a long time. So he's kind of working on that.
So if I just want to comment really quickly on this membership committee meeting, and if this board remembers, the membership committee did a lot of work on thinking about how to reconfigure the board and whether or not our board was adequately representative of all stakeholders, if it was too big, too small, what was the different kind of options to look at our board membership. It kind of was met with a pretty less than enthusiastic response, I would say, by the board, by at least at the one meeting that we discussed it. So I really probably needs to be revisited. But there was a lukewarm response to the direction that the membership committee was going in. And we sort of felt like we're back to the drawing board on that. I do want to comment for the benefit of those who are here. We are struggling to get a quorum at a number of our recent meetings. And so as somebody who is somewhat responsible for helping to facilitate this coalition, I have a lot of concerns about expanding the size of our COC if we're not able to reach quorum very easily on our current size. So I'm just putting that out there. And I'm hoping that all of us who are showing up can help figure out some ways to make this a really effective, efficient board, because we need to be effective and efficient in the extremely very close near future based on the expectations of the state and the fairly massive amounts of new funding that is coming to our communities for homelessness. Sounded like I was scolding you all. I'm not scolding you because you're here. I'm just like getting us in the right mind frame for having to make some like hard decisions really soon. And membership's going to be one of them. HMIS Performance Measurement Committee. Brian, do you want to share what you'd like to share from that committee?
Sure. Current big picture data completeness report cards attached to the COC agenda. It was a very short meeting, maybe about a half hour. No big work being done this month. We did set a subcommittee to do a formal review of the HMIS lead agency, which we've been missing for a number of years. That subcommittee consists of Drew from Ford Street Project, Sage from RCS, and Paul from Mendocino Coast, and they'll be led by Melissa Michael from our HUD Technical Assistance team, part of our capacity building grant to formally review the HMIS lead agency. Other than that, we just updated the exit destinations kind of community resource chart and guide. And that's everything that committee did last week.
Okay, thank you. Any questions or comments for Brian? All right, moving on to ad hoc committee reports. Brian has shared with us the 2022 point in time count overview. So that is in your packet. And the page that I usually look at is the one that he put in here on page 12 of your packet. And it gives the report as submitted to HUD, I believe. So Brian, do you want to tell us what we need to know about this?
And to be clear, it is a draft. So it is
Okay.
submitted to HUD. Historically, they come back with a lot of questions. The numbers can change sometimes a decent amount. I think this year with our use of the point in time count app, we've really simplified the reporting on a lot of the data errors that used to occur. I believe we're not going to see them at all. I'm very comfortable with these numbers. Again, everything is up to HUD's final approval, but I think this year our numbers are fairly realistic and accurate. It's compared to previous years, There's a huge increase in the last 2 years in the number of people in emergency shelters. This is due to COVID-19 response, as well as bringing in agencies like CalWorks that had never really participated well in the past. So we weren't accounting for all the families that they had in motel rooms. So we're seeing a really big increase in sheltered projects. The bulk of that is COVID-19 related projects like Project Room Key and things like that that are keeping people safe who are COVID positive or asymptomatic, high risk, or exposed. So we're going to see those shelter numbers, I suspect, go down in the next year or two whenever COVID ends and COVID funding ends. I'm not going to guess as to when that is, because every time we guess, it gets extended. Our transitional housing numbers continue to go down. Main reason, Ford Street project migrated from a transitional housing project type for Unity Village to an emergency shelter type. This is kind of a national trend. You're seeing people moving away from the transitional housing model and adopting more of emergency shelters and a housing first model, and not saying, we'll live in this program for 2 years and then maybe you'll be ready for housing. And a lot of the funding is moving away, in my opinion, from transitional housing. And that's why a lot of agencies are moving to emergency shelter. Funding sources like ESGCV, which is funding Unity Village, doesn't fund transitional housing project types as well. So you can see the loss of those transitional housing beds are actually adding to our increase in emergency shelter beds. Those are 10 rooms through Ford Street Project Unity Village for families that normally would show up on your transitional housing. As far as the unsheltered count, we did a lot of work this year in both using the app and evaluating data. For the first time, we were able to get in and look at data points, like we were tracking the last 4 numbers of someone's license plate, and we could actually see if a car was counted 3 times or 2 times with that data. We were able to go in and remove structures and vehicles that were marked as clearly abandoned. We were able to see if the same person was counted 2 or 3 times, if they took their name. And those are some features we've been missing in the past. Normally, we just count the structure. This year, using the SimTech app, we were able to get enough data to deduplicate. We also had a committee review the modifiers. So if you're saying if there's a person in the car, every car counts as 1 person or 1.5. So we reviewed those for reasonableness and accuracy. Our unsheltered count is the 2nd lowest number we've ever had. It's still pretty much in line with where it's been the last several years. One reason you're going to see that big reduction, not that it's big, but you'd expect a reduction in unsheltered count because you have double or triple the amount of people in emergency shelter beds. So that aligns with the data we have saying our emergency shelter beds are increasing. We've got all those COVID programs taking people off the streets. So you would expect to see a slight dip. Overall, I'm pretty comfortable with our numbers. I don't suspect HUD's going to have any big issues. And I will open it up to any questions about point in time count, as well as our housing inventory count.
Any questions for Brian? So because I was reviewing it recently, I'm reminded that one of the commitments that we made in our strategic plan was to do a press release each year with about the point in time count. Always a risky endeavor. Brian, would you say that would you think the timing is right to start working on that, or do we need to wait a little bit longer?
I think if we work on it now and get it roughed in, if you want to wait till HUD approves the numbers, it's interesting because it takes HUD so long to approve things. By the time they approve it, you're closer to your next point in time count than your original count. But if we're waiting till HUD approves the numbers, I still suspect we're going to be approved with very minimal changes. Again, I can't state that for sure, but I strongly suspect if we work on a draft right now, we would be fine.
Okay. Any other questions or comments about the PIC count? I think we can congratulate ourselves on using the mobile app for the first time this year. It went really well and I loved it. So that was a much smoother transition than I thought. I thought it was going to be really problematic, and instead it was the opposite. So good to see some progress in some things. Yeah, Brian?
I would like to say, using our app, we had the option for reunification surveys. So we were working with people experiencing homelessness who have a family member or friend that they want to reconnect to. And we have had one reunification survey actually hit and be successful in that they found the person's family members and are now seeking to connect the person experiencing homelessness back to their family who very much wants to reconnect. and get back in touch with their family member. And so we can only expand on that sort of program. And the more we use it, the longer we use this app, we're going to have access to these reunification surveys. And you're seeing some pretty good national trends on this kind of work as far as using alternative resources to help people out of homelessness. And that's connecting them back to their family who is engaged and wants to be connected back to them. So just very happy to see that our reunification surveys, we are seeing some forward momentum with them and actual results.
One of the additional things with the app is that reunification survey is open year round. You don't have to be open during a point in time count to use it. So anyone who has access to the app and has used it before can continue doing those reunification surveys. I'm not certain how often they're exported to Miracle Messaging, but it's a way to capture the information with the client at that moment. And so you're not waiting for the 10 days every year to just use it.
Great. Okay. We do not have anything under board protocols and governance right now. Moving on to item F, updates for the board around funding. Veronica, do you want to let us know what we need to know about the HUD Continuum of Care program competition debriefing?
Yeah, I received it. It's a review of the scoring that HUD assigned our entire COC collaborative application, not each individual application. Those are sent, I believe, directly to those applicants, and they're not sent to the COC. I've included the document in with your packet after the information on the point in time count and the housing inventory chart. It starts on page 13. We got a moderate score. We're reviewing the previous year's debriefings to be able to compare our scoring from this year to past years to see where we've improved. This last year, HUD added a lot of new questions. They added a large section on COVID-19. And so there was quite a few new questions that we won't have any historical comparison for. But once I'm hoping to have that done for our next meeting or our next full membership meeting, one of the two. So does anyone have any questions about the scoring? We got 116.25 out of 173. Go ahead.
I haven't looked at this very closely yet, but I do. So I might be off base here, but I am noticing that an area that we did not receive a lot of points, or the maximum points available is 22, and we received 12. So it was an area of improvement. Was on our project review and ranking process that our COC uses in its local competition, and it looks as if where we didn't score as highly as we could was our use of performance data to review and rank projects. So I'm highlighting that because I think it is interesting and notable.
So one other thing that I'd like to clarify, especially since you brought that one up, during HUD's debriefing webinar, so they did a webinar recently on this document, they said that the way they phrase certain things, a lot of people didn't have consistent understanding of those questions across the board. And so our COC has actually made quite a bit of improvements in that area. So I'm wondering if the way that HUD phrased the questions didn't quite align with the work we've done. I'd have to do a bit more research into that though.
Okay. Well, thank you for that, Veronica. Is any other comments or questions from?
I've glanced at the ranking and rating scores. While we have done significant improvement, there are several points that they're looking for that aren't included in our rating and ranking tool. I think we just got a lot further to go with it. identifying, we've made very big strides in that rating and ranking tool in the last year or two and making it a functional, realistic tool. But there's several points that don't align with what HUD's looking for in that specific scoring factor. The one problem I'm having trouble with on this sheet is that it will list points, but not actually tell you what your scores are. For example, 1B and 1C is a total of 74.5 points, but when you look on the sheet, it only shows you the score for 1C, and I'm not sure what 1B is or how we scored or how that added up. So there's not alignment between their categories and the actual scores they give you, which is confusing and hard to figure out where you can improve for those that aren't listed at all.
Okay, like there's a lot to look at here, so I appreciate our staff's, actually paying attention to this. So thank you for that. Item F1B, Emergency Solutions Grant Program. Veronica, do you want to give us some updates on this?
Yes, I have really good news to share. HUD released CPD Notice 22-06 in April, the end of April, and they announced that HUD has extended ESG-CV by another year. They've extended expenditures, like grant expenses or direct client services can be provided and eligible for reimbursement through September 30th, 2023. They are also adding an additional 3 months for the grantees to finish the paperwork and get paid for the amount of time that they spend closing out the grant. So those were some really great forethought on the part of HUD. And so we're really excited. There is one daunting task that we have in order to get there, however. HUD is requiring that all grantees demonstrate they've spent 50% at least, 50% of their award by their June expenditure reporting deadline. That translates to Mendocino County has to have at least 50% of expenditures reported to HCD by June 2nd. So we're not out of the woods yet, but we definitely have more time to spend the funds that we have, as long as we can keep them. So I've been working diligently with all of our contractors to get their updated invoices to me so that we're not in danger of losing any funds. I also wanted to share that the Rapid Rehousing Coordinated Entry Technical Assistance that we've been awarded, we've done a lot of work to establish a weekly case conferencing meeting. And I just wanted to let the board know that there's some major progress that's going with our clients there. We've got a lot of clients assigned, and now we're focusing on really ramping up housing placements. So our landlord liaison project at CDC is taking off. Danielle Wilfong is doing an amazing job over there and is really working hard on recruiting new landlords and repairing relationships with landlords who have previously been burned. So Danielle's doing a really great job. Did you have something to add or ask, Natalie?
I just had a clarifying question on the ESG expenditures being at 50%. Is that for the entire county, for all of us collectively or individually?
So it's of the entire award that Mendocino County received. So of the $5.4 million, we have to have 50%. That doesn't equate to 50% of our contractors' budgets because everybody has a different timeline. And so I really can't say if you don't have 50% of your contract, invoice, then you're going to lose your, potentially lose funds. I can't say that because everybody's different. And so if we are unable to meet the 50% expenditure deadline and are subject to funds being recaptured, we'd have to look at that, where those funds would be taken out. I don't even pretend to know what we would do in a situation like that. And it would be a lot of people involved in that process and those decisions.
Okay, thank you.
You're welcome.
So Veronica, you must have some general idea. Are we getting pretty close to that 50%? So you're feeling pretty positive about that?
So we're about $450,000 shy from what I have calculated as of the end of March. And so this will be for April and May expenditures. I think we can get there. I have some funds that I haven't been able to invoice. It's specifically the indirect funds that the county has reimbursed our subcontractors, but HCD would not allow us to include in our reimbursement requests because they didn't have their system set up correctly. But then they fixed it and said, okay, invoices for a year's worth of indirect. And I just haven't been able to put together that large of a report in the manner that HCD wants it. I can't just say this much for this agency. I have to say this much for security and this much on utilities and this much on each and every single category. So it's really involved. I recently started technical assistance. They expanded our contract to also include assistance with the invoices and reporting to HCD. So I've got more help in reviewing your invoices to put them and translate them into HCD language and reporting. It's a lot.
Thank you, Veronica. It does sound like it's overwhelming.
It's a lot, but I think we can get there.
Okay. So that's a lot going on over here in our neck of the woods. Item funding, let's see, we're still on F1C, the Homeless Housing Assistance Program, HAP funds. Veronica, do you want to give us a quick update on that?
Yeah, I've updated the board on this several times in the past. I just wanted to keep this as a reminder that the grant application is due June 30th. And so the strategic planning committee is going to be helping us with establishing performance measures and goals. But I know that there's going to be some work for the full COC as far as collaborating with the county and how to use the HAP funds. We're trying to get through ESGCV right now, but once we get through this 50% expenditure requirement, I think we need to really hit a HAP. So if the COC members who want to be involved in that funding decisions and process establishment, you could look at the HAP NOFAs and other information, if nothing else, what our budgets are. And those are available online. I've posted them multiple times, but I'd be happy to share them again anytime if somebody wants to ask.
So just to update the board from, I had not been paying a ton of attention to HAP 3 because I was still kind of stuck on HAP 1 and 2 and all this other kind of COVID related money. But I do really want to emphasize that HAP 3 is the state's very intentional vehicle to establish goals for communities and hold us to them. So it's like they're big, it's like really intense to them. And Margaret Kislyak, who introduced herself in the beginning of the meeting, the managed care plans also have funding to contribute to the housing and homelessness world. And they are also looking to the goals that are established through HAP 3 to help inform their funding choices. And then on top of all of that, this all has to line up with our strategic plan, which needs to be updated. And we made some progress on that, but we're not like totally crystal clear on it yet. So I just can't stress enough that there is all the attention that we're hearing at the state level around housing and homelessness is absolutely being pushed down to local communities. there's an unusual amount of funding available to help solve housing and homelessness problems, and we have to actually do it. So just going to continue repeating that because it's getting me a little panicked. On the big picture spreadsheets that I keep track of, I want to remind us that the COC has made no funding decisions around HAP round 1 or HAP round 2. The county's spent a little bit of HAP round 1, nothing of HAP round 2. Veronica's getting ready to submit an application for HAP round 3, and HAP round 4 is right around the corner. And the partnership health plans also have significant funding to contribute to our homelessness and housing work. So we're going to have to really get this going. And there's going to be a lot of expectation on communities to solve problems. So I feel like I'm just like lecturing. Maybe I shouldn't chair anymore. All I do is lecture. So I'm just like letting you all know that that's in my head. Brian, are you just waving or you have a question?
Just a comment. So I've reviewed HAP Round 3 a bit, and I want to mirror what you're saying. It is by far the closest the state is ever going to be looking at our data, our outcomes, our priorities, our methods and models. Usually a lot of the state funding like cash and HEAP is, here it is, we're going to get some reports back. It's a drastic change in the way that they're going to be looking at how communities are spending funding. And every community in California is very much going to be under a microscope with HCD and outcomes and data with this.
Okay, so update funding, let's see, we're on 1D, our homeless emergency aid program, HEAP. Luckily, we have a few funding sources that we're almost like ready to close out. Veronica's asking if there's any updates from any of the capital projects that were funded with HEAP. I did briefly update about Ore Creek 2, which was probably our last one in the pipeline that was partially funded by HEAP. And so that's supposed to come online again in June. I do think, Lisa, perhaps you can weigh in. I was pausing for a minute, but this is not confidential. I do believe the opening of the plateau in Fort Bragg got delayed a little bit further than we had hoped. So I'm just saying that now. I don't think it's a secret. It was supposed to open this summer. It looks like it's closer to September now, but maybe Lisa, you have some more to add there.
You're right. It is September. Sorry, I'm working from home.
So that's a little bit unfortunate. There's a lot of people that are sort of in the pipeline or waiting. And now because it's delayed till September, there's just some pause in some of the application processing. If we all remember, a lot of the information related to income needs to be within 90 days. So it's a little bit of a scramble for the plateau to keep the applications that they have on file current so that they meet their criteria for September opening. And I don't remember why there was a delay. I don't know why that is, but that's still the plan. So
It was a PG&E inspection was required, but they couldn't do it. I think it's not until June 1st. And then there's additional inspections that need to be done after PG&E signs off on it. And so it's just a lot of items that are in California law that they just can't budge around.
okay.
And it sounds like also construction was an issue as well on this
Okay.
most recent update.
Okay.
Okay, so that's, I don't think there's any other updates on HEAP. We don't have any updates on CASH or the HMIS capacity building grant at this time. So I think we're coming near to the end of our agenda. Is there anything any members want to bring up?
I do have an announcement. I wanted to share that there is a training opportunity that is available to any COC members. And I'm pulling it up right now. It is through HUD's Technical Assistance Regional Teams TA Initiative. It's a 2-part training workshop facilitated by expert TA providers. It's a 2-part series that will focus on the requirements of the continuum of care and how communities can fulfill those requirements through collaborative relationships and clear roles and responsibilities between and among various key stakeholders like the COC board, collaborative applicant, and HMIS lead. They are offering 2 sessions for each of the 2 parts. So there's 4 opportunities, but you only need to take one of each. So if you can't make the first one, there is a second one. I did forward the information out to all COC members, not just board members. But if you did not receive it and you would like to, please let me know. And I just really wanted to call your attention to it. It is free and it could really help you understand the COC board and its roles and responsibilities better.
Okay, any other announcements from members or members of the public?
I don't have an announcement, but can I ask a question going back to, this is Angelica, the HAP monies? I just want to make sure I understand, Megan, what you said. It's basically all these monies from round 1, round 2, and round 3 are there, but we're not, the COC hasn't decided what to do with them. Is that correct?
So it's round 1 and 2 that the COC has been awarded. We haven't finished the 3rd round yet. There was an initial allocation for round 3 that we've received that's for like strategic planning and stuff, not actual direct services. So it's really the first 2 rounds that we need to really get on. How are we going to spend these?
And what kinds of things can the
So,
COC spend?
Angelica, it's quite flexible. There are some restrictions. It can cover the gamut from homelessness prevention to actual homeless services as well. There is definitely a de-emphasis on all of it going to emergency shelter. They're really, really stressing permanent housing and permanent recovery from homelessness in that funding source. But it is definitely one of the more flexible funding sources out of all the ones that we've seen. I will say, Angelica, the reason that there's been a pause in the COC, and it's very messy. So rounds 1 and 2, there was 2 allocations. There was an allocation to the COC and there was an allocation to the county. So in round 3, the state forced us to work together, which is not a bad thing to do. But what it means is that there's at this point 5 different grants out there, separate grants with separate funding allocations, with not everybody, with different people in charge of them, different people meaning different entities. It was a long way, Angelica, to say, but what happened is that during COVID, the ESG allocation was so significant and so specific to COVID that all the attention of really all the homeless service providers turned to accessing and expending that funding source first, because it has a closer timeline, a nearer timeline than the other ones. Does that make sense, Angelica?
Yeah.
We were all focused on HAP, and then the pandemic happened and we really shifted away from that for like the last 2 years. So now we have to start thinking about how we're going to re-engage in that funding source and the goals of that funding source.
And then is there a timeline, or is that something that the strategic planning committee is going to look at to bring to the board to figure out?
There's a timeline for each of the allocations. They mostly have a 4 or 5 year, I can't remember, 4 or 5 year funding spending timeline, but HAP 1 was now a while ago. So 50% of HAP 1 needs to be encumbered by next spring. And the county's allocation of HAP 1, 100% of it needs to be encumbered by next summer. So it's got these sort of complicated rolling deadlines in it, but typically each of the allocations, I can't remember if it was 4 or 5 years, had a 4 or 5 year spending plan, which is why we were not that focused on it in the beginning. 5 year, Veronica would say that's why we were not that focused on it in the beginning of the pandemic, because it felt like we had a lot of time, but we don't have as much time anymore. So that's what's coming up.
And in the request for qualifications I had rolled out, one of the activities is called permanent housing retention support. And it's not eligible under ESG, but it is under HAP. And so I do have some requested funds for that activity type only. That is definitely it's going to be the first go-to, because the COC has gave its blessing to use that budget category line item. And it's something that our homeless service providers are actively asking for. And so we can take that first baby step with that funding, but we're going to need to look at the remaining amount.
Okay, so I think we might be ready to adjourn. Our next meeting is Monday, June 23rd at 1:30 PM. We're skipping. It's
That's not a
moving from the
Monday.
3rd to the 4th sorry, what? Did somebody say something? No.
I said, that's not a Monday.
That's not a Monday?
No, it's a Thursday.
I was looking at May. So it's 27th.
June 27th. Thank you. Thank you, Noble. So June 27th. Monday, June 27th at 1:30, we're skipping, is this correct? Then we're still skipping June 20th because it is a county holiday, or it might be more than a county holiday. It's a Juneteenth
Federal.
holiday, so federal holiday, so a lot of people will not be working. And then we do not have a July meeting, I believe. Veronica, is that correct? Did I make that up?
No, I
Okay,
have no idea what you're talking about. We have a July meeting.
we
Please
have a
come
July
with
meeting. Okay.
It's
I thought
a-
we were
it's a
skipping a
full-
meeting.
It's a full member meeting,
Okay.
not a board meeting.
Okay, so there is a July, forget that. So our next meeting is June 27th at 1:30 PM. And there will be a strategic planning committee meeting in between that and hopefully some other committee meetings in between that time. So thank you all. I'm just scanning my screen and it looks like everyone's ready to go. So have a good rest of your afternoon.